Um, Next speaker will be a very distinguished, nice-looking lady from Russia, Dr. Evgenya, and she's going to speak about something different, the digital media, the social media, and how can we control, or how can we promote diabetes and control it with the help of the new media. Okay.
Dear Chairperson, thank you for a warm introduction. And I again want to emphasize that it's a great pleasure for me to be here. As you know, I am for the second time in Cairo, in Egypt, and now I'm feeling myself like I am at home. And of course, it's because of your hospitality, because of your kind eyes, and because your great interest in diabetes care field. So thank you for everything, what you're doing here. And my personal thanks to Professor Inas, who invited me to this conference, organized everything here. Thank you very much. Before we will start, I just want to remind you that if you want something from the presentation, any slides or schemes or pictures, you just can write me by email, which is written here. Since yesterday, I have already a couple of emails, so don't hesitate. Write me if you need something. Don't waste your time by making pictures or something like that. And we will start to discuss for next 20 minutes the diabetes care in digital era. During yesterday's lecture, we just started to perform something about it, but now we will just be more focused on digital medicine and in these points which are very important now in diabetes care. First, let's start from definition. Of course, the digital medicine is the use of digital technologies as medicine designed to manage, rectify, alleviate problems with health and well-being. And we will discuss something about education and possibility of digital medicine here, mobile applications, telemedicine or virtual clinics, real-world data or big data. Let's start from education. And thank you for a previous lecture about the great things about education. But now I want to stress that we can use digital medicine not only for educate our patient, but also to educate us as healthcare professionals. So how can we use it? For example, now there are a lot of points to do in internet resources. For example, there are e-learning materials now at the webpage AASD.org. And you can use it for free. And also, as a small example, it was a questionnaire for healthcare professional. It was about 200 residents, and the question was about the ways of learning. And we have answers. Almost all of them, 100%, prefer health education lectures in animation rather than text, understandable. A great amount of them are able to spread the health knowledge after learning that in that way. And of course, almost all of them think that using these formal communication materials not only makes health knowledge persuasive and imaginative, but also makes it interesting and appealing. And I think it's a point. What we can use here in terms of patient education, of course, we know that structured education is very important. But we need to remember that we can use some additional things, like new approaches to therapeutic education of our patients. It's flexible regimens, maybe sometimes social club, web resources, online information, social media, text messages, mobile applications. Sometimes if we are talking about children with temporal parentectomy, so-called. And here is a place for digital medicine also. As a small example, just a couple of them. First, if you remember, yesterday we discussed the possibility of gamification for adolescents or children during the patient education, but it's also possible to use it even in old population. And I think it's a great idea to remember about it. The second example, it's about some programs which is possible to use even for personalized dietary advice. And it's easy to perform, and it's very successful. Do we have any problems here, or everything is bright and sunny? Of course we have. Digital technologies are dynamic and heterogeneous, constantly shifting in their meanings according to the context in which they are used. And also sometimes the information there is inaccurate and misleading on the internet, and some websites are run for profit. So it can be an issue. And that's why we have some risks. Of course, this violation of privacy and confidentiality. Sometimes it's overloading of data, difficulty of switching off mobile devices, of course, some technical issues. But as a main thought, we need to remember that there are a number of digital technologies to support education, not only for patients, but also for healthcare professionals. How we can perform it? Of course, we can use it by internet resources, as we discussed yesterday, or even with mobile application. And as you can see here, great amount of people use mobile application. So let's start our small discussion about mobile application and its usage in diabetes care field. Of course, all of us know that applications grow popularity now, especially in recent years. Great amount of adults have access to a smartphone, regardless of socioeconomic status or ethnicity, and it's very important to remember. Great amount of smartphone users globally. It's like 36% of world's population, even more than 2 years ago. And half of smartphone owners use their device to obtain health information, also about diabetes. Why we need to discuss this? Because it's easy to access. Of course, it's discrete and immediate, meet and immediate needs. For example, it reduces disease burden, improve health, make life easier for some of our patients, provide novel information, and provide psychological support. But also, there are some concerns here. Usually, applications poorly integrated with healthcare delivery, content not always at an appropriate level for users, and it's especially important for healthcare professionals, lack of guidance on applications, concerns regarding accuracies and quality of medical advice, which are written there, and of course, lack of evidence-based and theory-driven underpinning. I would like to share my philosophy on this field. So if we will think about application, we just need to divide it from the patient point of view, healthcare professionals' points of view, and industry points of view. Before we just trying to understand this sort of philosophy, just some words about classification. Now we can divide it application for the purpose of prevention, diagnosis, and treatment of diabetes, like some sort of medical applications, and applications related to lifestyle, fitness, and well-being, like a non-medical apps. Of course, there are a lot of classification here because of function, cost, operating system, and so on and so forth. But I think that the main thing that we need to keep in mind is that there are arranged functions in these applications, even several years ago. And there are some data about it, for example, about application to calculate insulin dosage. Of course, as you can see here, there are some amount of applications, 46, I think is a great amount, but only 14 documented the calculation, so with explanation how it was performed, and only 10 of them modeled insulin on board, or active insulin, to perform the dose, and it was a great risk, 67% of inappropriate dose. So there's still a low level of information which is put in the application. If we start to think about applications for patients, of course, focus them be healthier, simplify daily diabetes management, help encourage many self-care behaviors, empower patients. As there are some reasons for patients to be involved in apps usage, of course, it's information again about everything aspect of diabetes, it's calculation because it's difficult for our patients, cooperation with treating doctors. And sometimes it's possible to share result with applications. There are a lot of very popular applications for our patients now. If you will try to find something in Google, it will be a huge amount of them. But if we think about application for healthcare professionals, of course, it's correspondence of patients' data, time management in the office, easy access, as there are also some reasons for us to use it, even to connection for international association as an example. But we also need to remember about applications from industry because there are a lot of examples of them. For example, as we discussed during the previous workshop on sensor and pumps yesterday, of course, there are some applications which can be used even for parents of children with diabetes to share the result from the sensor to smartphone directly. or even to have some information about blood glucose monitoring, to download information from the glucometer to smartphone, with which possibility to share the information with the doctor, like it's picture here. And there are also even the applications for do-it-yourself system. If you remember, we discussed something about open apps, the artificial pancreas system, which is driven by the patients. They also use some applications for download data and have possibility to watch the result on the screen of a smartphone. And there are some special applications here. Why do industry need to use applications? Because of adherence to their devices, for status, money, of course, sometimes for patients' opinion, and promotion. But if you remember the yesterday lecture, we also discussed there are some limitations in using of application because it's connected to device. Sometimes it's an inappropriate level of information. So we can conclude, for some reasons, for applications unsuccessful usage like time, age, knowledge, intellect, psychological issues, social status, internet access, too many useless applications. But if we'll try to imagine the ideal application, how it will look like free, of course, without any money, easy to use, with some number of functions, because there are some data that the easiest application is the most popular applications with one function or two, not with a lot of, rich and useful for concrete personal information, engaging, aesthetic, of course. So the main thoughts that we'll need to remember here, that the amount of applications is huge and it will grow in future. It's the present and the future of diabetes care. Application for patients work successfully with the help from healthcare professionals and industry, of course. So mobile application can have positive impacts of diabetes self-management behaviors. We just a couple of minutes to speak about telemedicine. Of course, every patient needs to access to health professionals. Sometimes it's not possible. There's a lot of definitions of telemedicine, but it's like a use of telecommunication to support healthcare, if we will talk shortly. There are some components, a process for accurate data collection, electronic medical record for data, a set of protocol for distant data analysis, variety of communication tools, and some system for automatically flapping and providing feedback for outlay data. And I think it's very, very important just to emphasize something about medical records, because of course it's a legal patient records. This is created in digital format in hospital and ambulatory. And of course we still have some advantages and disadvantages of that. It can help to reduce the amount of medical errors. Sometimes it's detailed and legible medical record. It's a better organization, up-to-date information. It's possible to have immediate access for information. Of course, we need some storage for our paper things. There is no possibility to use it here. Patient to access their own medical information. It's possible. Something organized in the process, and it can help with big data research. But also, there are some disadvantages, and it's very important to remember that it still needs to have a lot of money for this because it's expensive. We need to train our staff. There are some problems with hacking attack. Technical facility can matter here. Of course, different systems not communicate with each other, so it's not like a very brilliant situation, but we still need to use it now. It's a process of digitalization. There are some types of uploaded objective and subjective data of interest to managing diabetes, so we can use it during our telemedicine things. And a fundamental challenge here, I think, is the possibility to download the data, for example, like a paper diary of one of the patients, but now you just can download information from sensor, from pumps, even from blood glucose glucometer, so it's very useful to use this downloading during our virtual clinic examples. And of course, in telemedicine in diabetes care, we can use it like a typical office visit, but with some special programs. We can download special software, texting or emailing your blood glucose reading, for example, as patients, or using the doctor-patients portal, or doing some sort of video conferencing. And of course, we need to divide the processes, it's possible to use telemedicine like patients to doctor or healthcare professional or healthcare professional to healthcare professional. For example, in my country, it's very popular now because, you know, Russia have a huge distances between different areas, so we use this type, healthcare professionals to healthcare professionals, to have some communications with doctors in rural area. Of course, sometimes it's difficult, as you understand, and e-consultations can make sense. What it aims, of course, to support motivated patient, improve education, provide regular intensive support when needed without travel, and rapid access. There are some examples if you're trying to find something interesting in a virtual clinic like the Diabetes. You just can put it to the Google, and it's a real clinic in Netherlands. They're working mostly online with 24 hours support 7 days per week. It's possibility to communicate with the doctor by emails or even Skype or other possibilities. And there are some advantages and disadvantages again. The main advantages for telemedicine in diabetes care is access to quality care, and it makes sense, convenience, and cost reduction. If we'll talk about disadvantages, it will be spot insurance coverage, and for example, for Russia, it's a great problem. Less personal care, sometimes it's matter, and potential loss of privacy. But still, individuals should be adequately trained in use of these telemedicine technologies, and we need to remember about it. What about big data? The challenge of big data in our world is following. There are a lot of clinical trials running in parallel. A patient will generate a great amount of personal health data in a lifetime, like 300 million books, can you imagine? In Medline, there are a great amount of published articles in a lot of great journals with new article published annually, like 1.8 million. And the typical diabetes admin high-need patient has 100 plus page electronic health record. So now we have a great amount of data. Where and when we can use it? Of course, we can do it like a digital preservation to keep the records. Of course, for data analysis, like MBM Watson Health and decision support. In diabetology, epidemiology, like diabetes registers. Now they're going online. For research, like basic science or clinical research, and for making algorithm diagnostic and treatment of diabetes. So, as a summary, again, there are a number of digital technologies to support education for patients and healthcare professionals. Mobile application can have positive impacts on diabetes self-management behaviors. Individuals should be adequately trained in the use of telemedicine technologies. And again, further data on the efficiency, usability, acceptability of the more novel things is required still. But I just want to finish with these words because they're very wise, and even for this situation with the digital era in diabetes care, if you can dream it, you can do it. So let's do something together in this field. And again, welcome to St. Petersburg, the cultural center of Russia. Thank you for your attention.